Demand production of triage logs, duty rosters, and bed occupancy records for that night. 3. Establish conclusively whether the 2018 Ghana Health Service Directive was breached. And finally, determine whether professional misconduct or negligence occurred. If misconduct is found, sanctions must follow. If negligence is proven, prosecution must follow. If a systematic failure is identified, comprehensive reform must follow. Mr. Speaker, let me leave the House with these final thoughts. If a young man can be carried from one public hospital to another, refused at every door until he dies, then the social contract is broken, and none of us, I repeat, none of us is safe. Not the rich, not the poor, not the politician, not the ordinary man on the street. The death of Charles Amissah must force this nation to change. Human life cannot be subordinate to administrative convenience. Emergency cannot be optical. Our hospitals do not have the moral or legal discretion to abandon the dying. Mr. Speaker, I so humbly submit. Thank you so much indeed.
Yes, thank you so much. Honorable members, this is a very important statement and is of serious public interest. So let's take it as such and give the proper lead and further investigation into the matter. Please, Deputy Minister for Health.
Thank you, Mr. Speaker, for giving me this opportunity to comment on the statement made by the Honorable Minority Leader. Mr. Speaker, the death of any Ghanaian in this matter is unfortunate. I would like to take this opportunity to extend my heartfelt condolences to the bereaved family and the loved ones of the deceased, and also to the entire nation. Mr. Speaker, I am the Deputy Minister of Health and also a traumatologist. In other words, I'm trained as a trauma surgeon specialist and consultant. Mr. Speaker, the event that led to this unfortunate incident and demise of the gentleman is tragic and should not happen. Mr. Speaker, in surgery, we call this a never event. Mr. Speaker, a never event is an event that should never happen. Under no circumstance, Mr. Speaker, should a human being die this way. Mr. Speaker, however, governance is a continuum. Mr. Speaker, we have the ministry has, as the Honorable Minority Leader said, has constituted a committee that is looking into the issue. And in fact, they have met today. We have also done preliminary inquiries. And Mr. Speaker, as we all know, I believe that the management of Kolebu Teaching Hospital has also independently interdicted some of their workers that were in the emergency room that night. However, Mr. Speaker, the conditions under which the current government came into running the country, Mr. Speaker, was rather dire when you talk about our health system. Mr. Speaker, this was the previous government started the Agenda 111 project, Mr. Speaker. Agenda 111 at the end of 8 years, Mr. Speaker, there was not one single hospital. I'm not engendering debate. I'm just trying to explain the circumstances. Mr. Speaker, Agenda 111, at the end of 8 years, Mr. Speaker, there was not one single hospital that was operational. Mr. Speaker, in fact, what we came to meet was multiple hospitals littered around the country, some of them at foundation level. There was not one hospital that a human being could walk in However, they had spent millions and billions of Ghana cedis, to the extent that, Mr. Speaker, the Auditor General surcharged 35 contractors 7.9 million. And the refund that the Auditor General, Service surcharged.
Honorable Deputy Minister, please focus on the major issue.
Thank you, Mr. Speaker. I am guided. Mr. Speaker, the current government is serious about what is happening in our emergency rooms. We have constituted a committee that is looking into it. We are collecting data as to what is actually happening in our emergency rooms. Mr. Speaker, the issue is multifaceted. Is it the pre-hospital, the ambulance, the pre-hospital care, or is it indeed what is happening in our emergency rooms? The ambulance service, Mr. Speaker, we had 30 ambulances that are currently parked. Mr. Speaker, in the last 5 years, the ambulance service personnel have not been recertified. Mr. Speaker, the ambulance was there because of the proximity to the ambulance service. They got there on time and they did what was necessary. Mr. Speaker, the issue of no bed syndrome, unfortunately, is not a new issue. This issue has existed for so long, and unfortunately, we or the previous government was not able to fix it. Mr. Speaker, in this government, we will take a bold step. The John Dramani Mahama government is going to take a bold step to solve the problem of no bed syndrome. Mr. Speaker, we are going to retool the hospitals, starting from the CHIPS compound to the health centers, all the way up to
Majority Leader. Majority Leader.
Mr. Speaker, they requested to make a statement. I knew that this statement will raise issues, but at conclave, you said we should have it. Now, you've made a statement, she's commenting on it, and Mr. Speaker, just imagine the level of noise that is emanating from the other side. So, Mr. Speaker, can you imagine somebody using the word very insensitive?
Honorable members, please, let's listen to each other.
Yes, we need to listen to each other. You may think it is insensitive. You are talking about no bed syndrome. What does no bed mean? It means you didn't construct enough hospitals and provide enough beds. That's what no bed means. That's what no bed means. You may disagree with her, but that's her view. That's her view, that this is the underlying cause of the problem. That the hospitals don't have the beds. They don't have the space. They don't have the capacity. Because you promised and you did not deliver. You may disagree with her, but that's her view. Please, let's listen to each other.
Honorable members.
Thank you, Mr. Speaker.
Please.
We are retooling the hospital.
We agreed that we'll take 3 from each side of the house. So kindly wait when it's your turn. Then you can put across your views. But honorable members, I thought we agreed on some key issues. You are a Deputy Minister of Health. Do you need a bed to attend to emergency situation?
Thank you, Mr. Speaker. By definition, Mr. Speaker, an ambulance itself is a bed. An ambulance is what we classify as a step-down unit. The cart in the ambulance can be considered a bed. So in such cases, a patient can be treated in the ambulance.
Yes. even
is-
outside the ambulance,
Exactly.
outside the chair, even at the ward, do you need a bed to attend to? And
Mr. Speaker, the patient
so let's
can
move on,
actually
please.
be
Let's
treated-
move on.
Yes, the
Let's
patient can
focus on the
actually be
issues.
treated. That is why we have constituted a committee to look into it. And that is why, Mr. Speaker, we are retooling the ambulance service because they need to have the proper equipment in the ambulance, Mr. Speaker. It is not just the bed. Mr. Speaker, it is the bed plus the oxygen plus the IV plus the IV infusion itself plus the monitors plus everything in the ambulance. Mr. Speaker, an ambulance is not just a transportation device. So, Mr. Speaker, we are retooling the
Honorable
ambulances.
Deputy Minister, I was a minister for health. I know what I'm talking about. Please focus on the issue. The reason was that no bed. That is
Thank
why
you,
we've been
Mr.
told.
Speaker.
So focus on that. You've done well by establishing a committee to investigate the issue. So let's look at it seriously.
Thank you, Mr. Speaker. As a ministry, we are taking every step to ensure that such situations never happen in the country. Mr. Speaker, we are retraining our emergency services staff. Mr. Speaker, we are both training the doctors as well as the staff. We are even training the security in the emergency rooms. Mr. Speaker, we are also extending this into the ambulance service itself. We are going to ensure that all the ambulances have the necessary equipment to save precious Ghanaian lives. Mr. Speaker, this patient could have probably been saved if we had the proper supplies in the ambulance. Mr. Speaker, we are working diligently to avoid such needless deaths of any Ghanaian. And in conclusion, Mr. Speaker, I would like to express my heartfelt condolences to the family, and I would also like to express my condolences to the rest of the country. Mr. Speaker, under our government, such incidences would not happen. Thank you.